Good morning, I'm Matthew, one of the education practitioners. Behind camera we've got Louise today, who will be assessing this assessment, and we've got Beth, or Elizabeth, next to me, and I'll let her introduce herself.
Hello, I'm Elizabeth Finney and I am an EMT1 apprentice.
Beth, what cohort are you in?
2405.
2405.
Oh,
Good.
yeah.
Just to confirm that you're here for CT19 neuro assessment.
I am.
And before we came on camera, we allowed you to pick a condition, but it was blind and you don't know what that is.
Yep, that's correct.
Good. And I will be your patient or helper today, as in bystander or whatever. So you can ask me any questions and shout out anything to me if you want, and I'll try and give you the answers or the observations.
Yep.
Okay. I'll read out the scenario, and then it's over to you. Okay. So you good to go?
Yeah, I just need to get my JR calc actually.
Okay. Yeah, you get it now.
I'll get it now.
Okay.
Yeah.
Right, so your scenario is you are part of a double EMT1 crew, you're on an ambulance and you've been dispatched to a private address for a 999 call for a patient who is fitting. When you get there, you find a 24-year-old female. She's called Jane, and she appears to be actively fitting. I'd like you to assess and manage the patient and ensure her safety whilst providing the appropriate care.
Okay. So I'm going to don my PPE. There's no special precautions in place at the moment, but I am going to use my gloves just because I don't know the environment that I'm going into. I am going to do my DORA, looking for anything that I can slip, trip or fall onto, looking for any loose animals or beware of the dog signs. I'm also going to scan the room as I enter it, just looking for any flames, any cigarettes that aren't put out, just because I am carrying oxygen. I'm going to note the patient. I can see that they're currently having a fit on the floor, and that there is no catastrophic hemorrhage around as well.
You're all right. Come on, it's okay.
Hello,
Oh,
it's
hello.
Beth from the ambulance
Oh, yeah.
service. Can you tell me what's happened?
She just started fitting. I don't know what's happened.
Okay, what relation are you?
Just a friend.
Okay.
Yeah, I'm just holding on to her. I don't know what else to do. To
It's
be honest.
alright, don't worry. What's her name?
Jane.
Jane. Right, Jane, can you hear me? I'm just going to check the responsiveness of the patient and check pain response as well. No, I'm not getting any response, so I'm going to call for some paramedic backup.
We're about 10 minutes behind you.
Wonderful. So Jane is currently due on the APTI scale, GCS of 3 at the moment. And what I'm going to do, I'm going to manage this airway. I need to go back to the ABC, so I'm going to manage the airway. Due to having a seizure, the jaw will most probably be clenched shut. I don't want to put my fingers in there and cause myself an injury, but I'm going to try and get an MP airway in. By doing that, I'm just going to do a jaw thrust to open up that airway as well. I'm going to measure from the ear to the tip of the nose, and then do a beveled edge to the septum and put that MP airway in. And I'm going to try and get a second one in as well, same size. Okay. Is Jane epileptic?
Yeah, I think she is.
Yeah.
She mentioned something about being on some new tablets.
New tablets,
Yeah.
right, okay. How long has this seizure been happening?
About 8 minutes now.
Okay. So, what I'm going to do, I'm just going to check my JR calc. I've secured one MP airway in there. I'm just going to protect Jane's head as well, just to stop her from causing any bleeding. so this is classed as a critical illness, so I'm going to put Jane on a non-rebreather mask. I'm going to put on for 15 litres. I'm just going to attach this oxygen up. Okay. Alright Jane, we're here, we're helping you, okay? So I'm just going to put the oxygen on, making sure that it's in a non-explosive environment, and I'm just going to hold my finger over to let that bag fill up. Once it's filled up, I'm going to pop this on Jane. Okay. Okay, wonderful. Jane looks like she is stopping seizing, which is good. I'm just going to reassess the airway. Look at the chest, check for equal rise and fall as well. I'm going to pop a SATS monitor on.
So it's come back at 91. Oh, I've never seen a fit like that before.
Have you not?
No.
Right, okay. And how long did you say before I got here was she fitting for?
A good 7 or 8 minutes.
Right, okay. Jane, can you hear me? Can you hear me? Still not responsive to voice. Just going to check that carotid pulse as well. Just check for a heartbeat.
Pulse is 100.
Okay. And I'm going to check for a temp as well, because sometimes if patients hypothermic or hyperthermic, it can cause seizures.
36.8.
Okay. And we're going to check a BP as well. Okay, Jane. Just going to do responsiveness to pain as well. Just do a trap squeeze.
No response.
Okay, we're still GCS of 3. We'll keep that oxygen on. Patient is still a GCS of 3, so it is still classed as critical illness, and we've got a reduced level of consciousness. BP on.
BP is 140 over 85.
And I'm just going to do a quick cap refill as well, and I'm going to have a look and check the rest rate of the patient now that the seizure's finished.
Cap refill is 3 seconds.
Yeah.
Respiratory rate is 20.
Okay. Do we know if Jane's on any medication? You said she's started some new pills.
Yeah, but I don't know what it's called. I just
Okay.
know that she saw the doctor. She's always been epileptic as long as I've known her.
Yeah.
She saw the doctor maybe a week ago, and he put her on some new tablets. I don't know. Yeah, I'm sorry.
Right, it's all right, no problem. Before Jane started fitting, was there anything different about her?
No, we were just having dinner.
Right.
Yeah, just having dinner. We had some pasta and a juice. You know, nothing special.
Right, okay.
Hiya. Sorry it's taken me so long to get here.
It's all right, don't worry at
Off
all.
we go.
So we've got Jane here. Jane is 24 years old. She is epileptic. Before arrival, seizure was going on for about 7 minutes
Right,
before we
okay.
came, so we've been on scene maybe 3 or 4 minutes. She has only just stopped seizing. She's
Great.
got 15 litres on.
Great.
Bystander here had said that she has started some new epileptic medication or new
Okay.
medication, but unknown what that is.
Right.
All OBS apart from SpO2 are in normal range. We've got a slightly elevated BP, but we are still GCS 3.
Right, okay.
So what I'm going to suggest is we scoop Jane, keep oxygen on,
Yeah.
we get her onto stretcher,
Okay.
and we get her out onto the ambulance and go to ED, looking at the Manchester triage tool as well. We've got a reduced level of consciousness, which is straight to ED.
So, if I get a line in just in case it starts fitting again,
Yeah.
do you want to check the new score?
Yeah,
And
of course.
then we'll get them going. Thank
Yeah,
you.
no problem. So we are using it a 9 at the moment.
Great, thank you very much. So off to ED we go. Are we going on a red or an amber standby?
We're going to go on a red standby just because of the GCS.
Great.
And just in case Jane does start refitting on
That's
the way.
great. Thank you very much. I'm ending the recording now.